In this video, I will discuss what carnitine dosage to use. The two most popular and researched forms of carnitine on the market are L-carnitine and acetyl L-carnitine. The acetyl L-carnitine form, ALC for short, is responsible for the cognitive-related benefits of carnitine. So things like increased neuron metabolism and the benefits that stem from that. Reasonably healthy individuals who exercise can convert the L-carnitine form into the acetyl L-carnitine form. However, if you are over 40, it is better to supplement with the ALC form. The best dosage for L-carnitine is 1000 milligrams per day, or 1 gram of L-carnitine. If you feel you need more, you can go for 2 grams per day. But this is likely not necessary if you are taking carnitine for the long run. Never take more than 2 grams at a time, simply because it won't get absorbed. You can go above this dosage in order to get increased benefits, but this information is found in my advanced videos. You should know carnitine can be used with or without food. What is important is the water, as carnitine is water soluble. Let's now talk about some other forms of carnitine, and I'll make some dosage recommendations. When it comes to acetyl L-carnitine for young people without cognitive impairment, the dosage is 500 to 2000 milligrams per day of ALC. Most obtain satisfactory effects using the lower 500 milligram per day dosage. The therapeutic dosage of acetyl L-carnitine for older people without severe cognitive impairment is 1500 to 2500 milligrams per day. The therapeutic dosage of acetyl L-carnitine for people affected by Alzheimer's disease is 2500 to 3000 milligrams per day. For chronic fatigue syndrome, the ALC dosage is 2 grams per day in 1 dose in the morning. For diabetes, the therapeutic dosage is 3 grams per day in 3 doses. This clinical study used L-carnitine. For bodybuilding, 2 grams per day in 1 dose before workouts. This dosage is for L-carnitine. For postmenopausal syndrome, 2 grams per day in 1 dose in the morning. Again, L-carnitine was used. For cognitive enhancement, 1 gram per day in the morning. This is for the ALC form. For morbid obesity, 4 grams per day of L-carnitine in 2 doses. For thyroid conditions, clinical studies have used 2 to 4 grams per day of L-carnitine or 0.8 to 2 grams per day of acetyl L-carnitine or 0.6 to 1 gram per day of acetyl L-carnitine arginate, but the best results for thyroid conditions came from 0.6 to 2 grams per day of propionyl L-carnitine. A little tip for carnitine is to keep it refrigerated in order to maintain potency. The greatest improvements from carnitine are usually felt after 4 to 8 weeks of continuous supplementation. But it doesn't stop there. This is because the body continues to use the extra energy generated thanks to the carnitine to fix things that it left on the back burner. So think about your house. I'm sure you know of many things you wish you had energy to get around to doing. The body is the same way. By continually supplying it with carnitine, you allow it to get around to fixing those small little things which it never had enough energy to get to. By increasing cellular energy production, carnitine provides substantial and clinically validated benefits such as eliminating tiredness, increasing energy levels, promoting cardiovascular health, increasing neural activity, supporting immunity, promoting kidney function, and regulating blood sugar levels. In this video, you have learned what carnitine dosage to use for various purposes. Carnitine is a part of my essential nutritional supplement stack. If you want to see which are the products I personally use, then go to damianalexander.com/carnitine. If you want to learn more about critical nutritional supplements, life extension, and disease prevention, then subscribe to my YouTube channel at Damian Alexander's Vids. Lastly, discover the easiest and shortest way to double physical and mental energy, strengthen immunity, and restore health by visiting howtochangeyourOwnbatteries.com.